Hey everyone, it's Courtney at Radiance Skin Therapy. I'm here today to talk to you about one of the number one trending topics of 2020 in the aesthetic world, not COVID related. So that is thinning hair. A lot of men and women deal with thinning hair, whether it's genetic or there's other kind of underlying issues that might be contributing to the thinning hair, stress related. There's a lot of things that can cause it. And here at Radiance, we do offer two different treatments that can help with thinning hair. The first one is PRP, which is Platelet Rich Plasma. We've been doing PRP for over 5 years and we have seen some amazing results. What we do is we draw your own blood. So we draw your blood, we spin it in a centrifuge. That separates out the red blood cells from your platelet-rich plasma, which is filled with your own natural growth factors. Then we take that PRP and we actually inject it back into your scalp, and that helps to stimulate new growth. It kind of wakes up those hair follicles, and I call it the number one fertilizer for your hair. So it does a really good job at thickening that hair and creating a really healthy environment for hair to grow in. Another treatment that we offer, which is a newer one, is called KeraFactor. KeraFactor is actually designed to mimic human growth factors. So in this one little vial, there are 5 bioidentical growth factors that mimic our own growth factors. It also contains 2 peptides that help to nourish the skin and scalp and kind of condition the hair. We use this vial of KeraFactor with our Genius laser. So we do kind of stamp or microneedle little channels into the scalp, and then we apply the KeraFactor to the skin. And what that does is it allows that KeraFactor to penetrate down into those hair follicles and promote growth. So it works very similar to PRP, but it is a synthetic version of it. So I would say both really do allow that hair growth, and we do get great results from both treatments. So you might be wondering which one to choose. I recommend you come in for a consultation, you meet with one of our clinicians, and we can kind of go through your medical history, kind of your journey with the thinning hair and what's been going on with it, when you first started to notice it, things that might be contributing to it, and then we can decide which treatment might be best for you. Typically with KeraFactor, I'm noticing KeraFactor is really great for those that may have underlying medical conditions that may potentially affect their PRP. So if I have someone that's super healthy, in great shape, and maybe younger, and they take really good care of themselves, I might go with PRP because their PRP might be pretty effective. We know that those growth factors are there and that they are able to stimulate those hair follicles. If I have someone that has some underlying medical conditions, that could potentially affect their efficacy of the PRP. So I might go with KeraFactor. Also, people that don't like to have their blood drawn, or they're really hard to draw blood from, KeraFactor all the way. So there are differences between the two options as far as the frequency of treatments and kind of how many we recommend. Typically, both treatments do require a series of treatments, and then once we achieve those results, both of them do require maintenance treatments. So once we get those results, we want to maintain them because thinning hair can continue. So we don't want to have to repeat a full series again. So sometimes you do maintenance treatments throughout the year to kind of keep those results and keep your nice luscious locks. So if you do have any other questions, concerns on thinning hair, please feel free to give Radiance a call. We would love to sit down and chat with you and come up with a customized treatment plan for you. Thanks for watching.